Rinky Chakma, the former Miss India Tripura, has died after a 2-year battle with cancer. She was 28. Despite a surgery, she died after a 2-year battle with the deadly disease. Femina Miss India has shared a statement on social media expressing their deep sorrow at Miss Chakma's passing. Rinky Chakma was diagnosed with malignant phyllodes tumor, a rare breast tumor which usually affects women between 35 and 55 years of age. These tumors have the potential to be aggressive and spread to other parts of the body. To the surprise of many, this ailment is quite prevalent in our country. In India, every 8 minutes, one woman dies of breast cancer, which means about 1 in 10 women are likely to develop breast cancer in their lifetime. Women who have had malignancy in one breast have the higher risk of developing cancer in the other breast. Talking of its inception, breast cancer arises from a complex interplay of genetic, environmental, and lifestyle factors. Factors including a family history of breast cancer, early menstruation, late menopause, hormone replacement therapy, and not having children or having children at an older age can elevate the risk. If you are at the risk of having this cancer, you should have tests done at regular intervals. Self-examination also comes in handy for this purpose. We have an expert who will help you understand how you can do a self-examination of your breasts.
Self-breast examination is a way and an important tool for all women to examine their own breasts to look for early signs of breast cancer. It was devised by a breast cancer survivor to help out all her fellow ladies. It consists of 3 parts: learn, look and locate. So talking about the first one is learning. It's very important to know what breast cancer looks like for you to find those changes in your breast. If you don't know what you're looking for, you're not going to find it. So the symptoms of breast cancer are most commonly seen as a hard, painless lump in the breast. Then there could be some skin changes like a swelling in the skin or a pulling in of skin or redness over the skin which doesn't go away after taking treatment from your local healthcare provider. The other thing is that there could be some nipple changes like a pulling in of nipple or a nipple discharge. This may be clear or blood stained. There can also be swelling in your armpit or your neck. Any of these changes, if you find them, should be shown to your healthcare provider immediately. The second part is looking. Now this part is inspection, and you will examine yourself in the mirror. So you remove your top and your undershirt and you look at yourself in the mirror with your arms relaxed by your side. Turn right and left, look for any swelling or any pulling in, then move your hands up and see how your breasts are moving, and also bend forward and see if your breasts are falling equally. Sometimes a deep-seated tumor may be found in this way. The third part is locate. In this part, you will actually feel your breast to look for any lumps and bumps. So you will not be doing this or any other way. It's very important to learn the correct way of doing it. So with the flat of your 3 fingers, you will press your breast tissue against your chest wall and rotate it all over. When you examine your left breast, take your left hand, put it behind your shoulder, and with your right hand examine your breast. Now whether you go round and round or you go up and down, it's very important to cover your entire breast. At the end of this examination, you will squeeze your nipple to check for any discharge and check your armpit and neck for any swellings. So for your left side, you will examine with your right hand, and then the other side you will examine your right breast with your left hand. This can be done in the lying down position and in the standing position, and it's better if you do it in both ways. So this concludes your self-breast examination. Ladies, it hardly takes 2 to 3 minutes of your time. And when to do it? If you're getting your periods every month, then you can do it after day 5 to 10 of the first day of starting your period. So if you get your period on the first of the month, then you can do it anytime from 5th to 10th. This is because at this time your breast is at the softest and the least painful. There's no swelling. So it's easier to find anything, and you're also more comfortable doing the examination. If you've stopped your period, you're in your postmenopausal age group, then you can choose any date. So a lot of ladies say that you can do 1st of the month. Sometimes if the date of your birth is what you remember, then you do it on that same date every month. it's very important to remember that even if you miss and you remember it a day later, a week later, just do it then, because it's very important to just do it consistently. Don't lose heart if you find something. 8 out of 10 of all breast lumps are absolutely nothing and benign, which means non-cancerous. And also, don't get too casual if you find nothing in the first 2 or 3 times. Consistency is key when it comes to self-breast examination.
Do share this information with your family and friends and spread awareness. Our deepest condolences to Miss Chakma's family and friends. Do leave in your condolences for them in the comments, and do subscribe to Shosha for everything health and lifestyle.